Hey, what's up, everyone? This is Julie. Welcome to my YouTube channel. If you have not yet subscribed, please go ahead and smash that subscribe button. Kick the like button on this video and all of my other videos. You doing so actually helps my channel become more recognizable here in YouTube and also on Google. If you'd like to be notified whenever I upload new content, you can ring that notification bell, and every time I upload new content, it will notify you. All right, guys, so today in this video, I'm going to demonstrate how to perform the Prometric testable skill performs perineal care or pericare on a female resident. Now, here's the good thing, okay? If you have been watching my Pearson VUE pericare video, you're still in good standing. Yes, you're still in good standing with Prometric standards. There's only a couple of minor differences between Prometric and Pearson VUE. With Prometric, you are required to place a clean barrier on top of the overbed table. For the clean barrier, you can use a towel or you can use a Chucks, whatever you prefer, right? And then the second minor difference is that with Prometric, there may already be a linen protector underneath the resident. You have to assume that that linen protector is soiled. So before placing a clean, dry linen protector, you'll have to remove and dispose of the linen protector that is already underneath the person. Okay, so that is how I actually have my setup. I already have a linen protector underneath the resident. Okay, and if there is no linen protector under there, you're good to go. Just go ahead and place the clean, dry linen protector. Okay, so without further ado, let's go ahead and get started. I'm going to explain everything that I'm doing step by step. Okay, so of course, first you want to perform the opening procedures, which include knocking on the resident's door, addressing the resident by name and title, introducing yourself by name and title, explaining the procedure or what you are going to do. Go ahead and complete your safety check, right? Bed is low, wheels are locked. Give the person the call light in their hand, and then also provide them with privacy. So here we go. Hi, good morning, Mrs. Jones. My name is Julie. I'm your CNA, and today I'm going to provide you with pericare. But first, I'm going to do a brief safety check. I just want to make sure that the bed is in a low, safe position. Your bed wheels are locked. I'm going to give you your call light. And as you notice, I'm giving the mannequin the call light in the opposite hand of, or in the same hand as into which I'm going to turn them, right? Because I don't want that call light to fall out of their hand or anything like that. So whichever way you're going to turn the resident, go ahead and place the call light in that hand, or at least on that side close to their hand, okay? All right, Mrs. Jones, you have your call light. I'm going to provide you with privacy by closing your privacy curtain. Mrs. Jones, I'm going to go wash my hands, gather my supplies, and I'll be right back. Now, with Prometric, you have to verbalize washing your hands before you gather your supplies, okay? So because the supplies are going to be at the bedside, I'm training my students to go ahead and get this overbed table and drag it over to where the supplies are at, okay? So the first thing that I'm going to get is going to be a towel, okay? And again, you can use a Chucks. I just don't have any Chucks in supply right now, right? So I'm placing this towel over the overbed table as my clean barrier. Now, here's the trick. I'm going to collect the supplies in the order in which I am going to use them, okay? Again, this will help your students and the candidate in so many ways, right? As long as you have your orders in, or excuse me, your supplies in the exact order in which you're going to use them, that will help you, prevent missing a step or omitting a step. It will also cue you on what you need to do next, okay? So the first thing I'm gonna do, I'm gonna go into the person's bedside stand. I'm going to gather a basin. Use the soap will be in the basin. I'm going to gather 2 towels, okay? I'm gonna place one on either side. I'm going to collect 1 pair of gloves. I'm going to place my gloves on top of this first towel. I'm going to collect 4 washcloths, okay? I'm gonna place 2 here. I'm gonna move this towel over and place the other 2, okay? So you see, I have my basin, 1 towel with my gloves on top, 2 washcloths, another towel, my other 2 washcloths, and my soap, okay? So what does this do, right? Now, because I have everything in the exact order in which I need to use them, it will cue me on what I need to do. So I have my basin first. Okay, so now this is cueing me, hey, you have to go get water and fill the basin, right? Then I have my gloves on top of the towel. That's cueing me to, hey, you know what? Now you need to put on your gloves, okay? And then with this towel, hey, you got to place the linen protector underneath the person, right? The first 2 washcloths are going to be used to wash and rinse the front peri area. Then I have my towel, right? Because one of the most forgotten steps is drying the front peri area. But if you have your towel here, then you'll know, hey, I need to do something with this towel. Okay, I need to dry the front peri area. And then I have my last 2 washcloths, washcloths 3 and 4, which will cue me that, hey, I have to do something with this, right? Okay, I need to turn the person and clean their buttocks and rectal area, all right? So I have my supplies. What I'm gonna do now is go ahead and fill my basin with water. Okay, so when you are filling your basin with water, if the tap has 2, or if the sink, the faucet has 2 taps, you'll want to turn on both taps. If it only has 1, turn that 1 handle to the center setting. My sink has 2 handles, so I'm going to turn on both handles. I'm going to fill the basin with water. Okay. And I'm going to show you exactly how much water I have in this basin. Okay, not a lot of water. Okay, I don't know if you can see, but not a lot of water. And the reason I don't put a lot of water in the basin, and I don't train my students to put a lot of water in the basin, is because you don't want it to be top heavy, right? Where you may risk spilling it or dropping it, right? So I have my water. And now I'm gonna go back to check on Mrs. Jones. Hi, Mrs. Jones, I'm back. I have all of my supplies. I'm going to test the water. Now, testing the water, you can also test the water while you are at the sink filling your basin, but just remember to verbalize that you are doing so, okay? You can test with ungloved or gloved hands. You can test with your finger, with your wrist, or with your elbow, okay? All right, so I am testing the water. It feels good to me. Mrs. Jones, I would like for you to test the water to make sure that it's a comfortable temperature for you. At this time, the NAE should speak for the mannequin. If he or she doesn't, that's fine. You're going to be communicating with the resident, so all you have to say is, okay, great, Mrs. Jones, implying that Mrs. Jones said that the water feels good, right? So now I have my gloves next, right? So this is cueing me, okay, it's time for you to put on your gloves. So, Mrs. Jones, I'm just putting on my gloves. Again, you want to always communicate with the resident, even with the mannequin, right? Because you have to treat the mannequin as if they were a live person. All right, so I'm gonna move my table out the way here so y'all can see what I'm doing next. All right, Mrs. Jones, I'm just going to uncover you. I'm going to pull your sheets down to your knees, making sure I do not go past your knees because I do not want to overexpose you. I'm going to raise your gown to your hips. Again, making sure I do not overexpose you. And it's always good for you to say that so the NAE knows that you know not to overexpose the person. So you see I have a linen protector already underneath. I set that up, right? Mrs. Jones, I see that you have a soiled linen protector, so I'm going to go ahead and remove that. I'm going to roll it away from me and just push it up underneath you as much as possible. There we go. Mrs. Jones, on the count of 3, I'm going to raise your hips so I can remove the linen protector completely, okay? So I'm going to place my arm, okay, my non-dominant arm, because I want to use my dominant arm to remove the linen protector. So I'm placing my non-dominant arm under both legs high up, okay? All right, Mrs. Jones, on the count of 3, 1, 2, 3, we'll raise your hips, and I'm going to roll the linen protector away from me and pull it towards me. All right, Mrs. Jones, there we go. I'm just going to cover you back up real quick, okay? I'm going to go dispose of the linen protector in the soiled linen hamper. All right, Mrs. Jones, I'm going to unroll your gown up again. There we go. Sorry, your arm got caught up underneath you there. All right. So now I know that my towel is next, so I have to place a clean linen protector under Mrs. Jones, okay? Mrs. Jones, I'm going to place a clean linen protector underneath you. Oops. There we go. I'm just going to roll it away from me a little bit. I'm going to go ahead and line it up because I need to make sure that the linen protector is completely underneath your buttocks. So I'm going to line it up ahead of time. And then, Mrs. Jones, on the count of 3, I'm going to raise your hips so I can pull the linen protector through. Okay? Again, I'm going to place my arms underneath both legs, and on the count of 3, you can lift. 1, 2, 3, lift. Good job. All right, and you can get back down. I'm just going to roll the linen protector through. Okay. All right, Mrs. Jones, I'm just going to make sure I have it completely underneath your buttocks, and I do. I'm going to readjust your sheet so you won't be overexposed. Now, here's a cue to you and your students. If the NAE, while placing the linen protector or after placing the linen protector, if the NAE comes up close, right, 9 times out of 10, they are looking to see if the linen protector is completely underneath the person's buttocks, okay? So this is what you want to tell your students, and if you're, already a candidate, you want to make sure that you double check, okay, to ensure that the linen protector is completely underneath the person's buttocks, okay? So I'm gonna pull this table back towards me because you always want to have your supplies right next to you. But for this training video, I'm going to be moving it back and forth just so you can see what I'm doing so the table will not be blocking your view. So now I have my washcloths, right? So I know I need to do something with my washcloths. The first washcloth, I'm going to wet it. I'm going to squeeze it out, right? Because you don't want any water dripping. I'm going to open it up. I'm going to squirt some soap on it. Okay. I'm going to ensure I get the soap all over on all areas of the washcloth. Then I'm going to fold it in 4s. And I'm going to use the open corners. Okay. So I have my open corners or leaves, right? that I can use to, ensure that I use a clean area of the washcloth with each stroke. And you see I have the washcloth tucked underneath in my hand, okay, in my hand, because you don't want the washcloth dangling, right? So make sure you tuck it underneath your hand, okay? So now for training purposes, I'm just going to move my table. So the first wipe I'm going to do straight down the middle, okay? Mrs. Jones, I'm going to start cleaning you now, okay? I'm just cleaning straight down the middle. Then I'm going to flip the washcloth over to a new clean area. I'm going to clean one side of the labia majora, flip the washcloth over to a clean area, clean the other side of the labia majora, flip the washcloth over to a clean area. Now I'm going to open you up and clean straight down the middle to clean the labia minora. Okay, so I used the leaves. I still have the closed corners, right, that I can use. So with one of the side of the closed corner, I'm going to clean the growing area and then flip the closed corner over to a clean side and clean the opposite side of the growing area. Okay, now that I'm done, I'm going to place this washcloth on my basin. I'm going to take the second washcloth, wet it, squeeze the water out. I am not going to place soap on this washcloth because this washcloth I'm going to use to rinse, okay? I'm going to keep it on fours and I'm going to rinse in the same manner that I washed. All right, Mrs. Jones, I'm just going to rinse the soap off of you. I'm rinsing straight down the middle, flipping the washcloth over to a clean area, cleaning one side of the labia majora, flipping the washcloth over, cleaning the other side of the labia majora, flip the washcloth over. I'm going to open and clean straight down the middle to clean the labia minora. I'm going to turn the washcloth over to my closed corners. I'm going to rinse one side of the growing, flip it over to a clean area of washcloth, and rinse the other side of the growing. Now I'm going to place this washcloth on my basin. All right, so now I have my towel. So this is cueing me that I need to dry, right? So you always want to make sure you wash, rinse, and dry from front to back, right? So now I'm going to take my towel and I'm going to dry, right? The areas that I just washed and rinsed. Mrs. Jones, I'm just going to dry you with the towel from front to back. I'm going to pat dry, front to back. There we go. And now I'm going to place the dirty side, okay, because I used this side, down on the table. That way I know that I had the clean side is facing up, okay? So now what I'm going to do, I have to clean the buttocks and rectal area. So I have to turn Mrs. Jones away from me. Prometric does not emphasize nor do they score on the raising and lowering of side rails. So you don't have to waste your time going to the other side to raise the side rail as you did with Pearson VUE. However, Prometric does emphasize and score on having that resident dangerously to the edge of the bed. So before you turn the resident away from you, you'll want to move the resident closer to you, okay? Mrs. Jones, I'm going to be turning you away from me. So what I want to do is just move you closer towards me to ensure you're not, too close to the edge of the bed, okay? So I'm just going to place my hand on your thigh and on your behind your shoulder. And on the count of 3, I'm going to bring you towards me, okay? 1, 2, 3. All right, awesome, good job. Right, so now I have Mrs. Jones closer towards me, so when I turn her, she will not be dangerously close to the edge, okay? And guys, I'm gonna have to move my table over here. Yay! Okay, there we go. All right, Mrs. Jones. So on the count of three, I'm going to turn you away from me. The best way to do this, right, is to place the resident's arm that's closest to you across her tummy, okay, and then to bend her knee, okay, and bend it high because this is going to be used, her knee is actually going to be used as an anchor to keep her maintained on her side, okay? All right, Mrs. Jones, so I'm going to place one hand on your knee, one hand on your shoulder blade, and on the count of three, I'm going to turn you, okay? 1, 2, 3, and we slowly turn you. There you go. Good job. And voila. See, Mrs. Jones can stay on her side by herself because I raised her knee up high when I bent her knee, and I'm using it as an anchor to so she can maintain this position. Now, during testing, if you are having trouble, keeping the mannequin on its side, either the NAE will just initially come and assist you with holding the mannequin for you, or you can even ask the NAE or proctor to give you a helping hand to hold the mannequin in place for you, okay? So now I'm gonna move my table back over here. Sorry guys, during testing, you won't be moving your table back and forth, okay? I'm just doing it right now so I can make sure you have a clear view of how I am performing this skill. So next in line are my washcloths, right? So I'm going to take the third washcloth that I gathered. I'm going to wet it. I'm going to squeeze it out really good because I don't want water dripping all over the place. I'm going to apply soap. I'm going to spread the soap on all areas of the washcloth. I'm going to fold my washcloth back into fours. All right. And then again, I'm going to use the open corners or leaves, right, to clean the buttocks and rectal area. Again, you want to clean from front to back. So you're going to be wiping from the front peri area up towards the back. Okay. All right, Mrs. Jones, I'm getting ready to clean your rectal area and buttocks. I'm going to clean straight up the middle. Flip the washcloth over to a clean area. Clean one side of your buttocks. Flip the washcloth over. Clean the other side. Flip the washcloth over to a clean area. And then straight up the middle again to clean your rectal area. Now I'm going to place this washcloth over my basin. The last washcloth, the fourth washcloth, I'm going to wet it. Squeeze out the water really good. Again, you don't want water dripping. I'm going to keep it in all fours or fold it in fours. And then I'm going to rinse the buttocks and rectal area in the same manner that I washed it. Mrs. Jones, I'm just going to rinse the soap off. Again, I'm going to clean straight up the middle, flip the washcloth over, rinse one side of the buttocks, flip the washcloth over, rinse the other side of the buttocks, flip the washcloth over, and then rinse straight up the middle again. All right, I'm going to place this washcloth over my basin. Now remember, when I place the towel down after I dried the front peri area, I place the dirty side down, right? So I know that the top side of the towel is clean. So now I'm going to dry in the same manner, pat drying from front to back. All right, Mrs. Jones, I'm just going to dry you off. Pat drying from front to back. There we go. And now I'm going to place this towel down on the table, okay? The most forgotten step is the removal of the linen protector. So while you still have the patient turned to the side, you want to go ahead and remove the linen protector. I'm going to do that by rolling the linen protector away from me, pushing it up underneath Mrs. Jones as much as possible. All right, Mrs. Jones, on the count of three, I'm going to go ahead and turn you back over. 1, 2, 3. Good job. I'm going to get you straightened out here. I'm going to remove the linen protector. There we go. I'm going to get you covered back up. I'm going to move you to the middle of the bed. There we go. You still have your call light in your hand. I'm going to take this linen protector, place it on the table. Mrs. Jones, I'm just going to cover you back up. There we go. Now, all I need to do is my closing procedures and dispose of all of my supplies. Mrs. Jones, I'm all done. Before I leave, I'm just going to do a brief safety check. Your bed is still in a low safe position. Bed wheels are locked. You still have your call light. Privacy is maintained. Is there anything else I can do for you? Okay. All right, Mrs. Jones. Well, I'm going to go dispose of my supplies and I'll see you later. So now what I'm going to do is take all of my soiled linen, place it in the clean area, right, which was the towel. I'm going to remove the soap. I'm going to roll it up so I won't have any parts of it dangling. I'm going to take my basin along with me, right? I'm going to place the linen in the soiled hamper, and now I'm going to empty, rinse, and dry my basin. So I'm emptying the basin into the sink. I'm rinsing the basin. And now I am drying the basin. And you want to make sure that you dry the basin completely, because you have to place the soap back into the basin and the basin back into the nightstand. So I have it dried completely. I'm going to grab the soap, place the soap in the basin, and then I'm going to place the basin into the nightstand. I'm going to remove my gloves without contaminating myself. Pull from the middle, ball up, and then grasp your glove from underneath. Dispose into the trash can. Then I'm going to verbalize washing my hands. I'm going to think, go back through all my steps, right? To make sure I did not omit any steps and to make sure I performed all the steps correctly. Once I feel confident, I'm going to verbalize washing my hands, skill complete. And that's it, guys, right? Very similar to Pearson VUE's Pericare, right? So not too much of a change. Again, the only difference is you having or being required to place a clean area over the overbed table. Again, you can use a towel or a Chucks. And then at the testing site, there may already be a linen protector underneath the person. Again, the candidate has to assume that that linen protector is soiled. So you'll have to remove that linen protector and dispose of it before you place a clean, dry linen protector. And then if there's no linen protector under there, you're good to go. Just go ahead and place the clean linen protector. Remember, you have to be wearing gloves before you do place that linen protector, okay? And then another, difference is that Prometric does not, I repeat, they do not emphasize nor do they score on the raising or lowering of the side rails. Okay, so you don't have to waste your time doing that. You just want to make sure that that person is not, once you turn that person, they're not dangerously close to the edge of the bed. In order to prevent that from happening, before you turn the person, go ahead and move them closer towards you and then turn them. All right, guys, that is it. I hope you enjoyed this video. I hope it will be helpful for you, the instructor, the student, and nurse aide candidate. Again, if you have not yet subscribed to my channel, please go ahead and smash that subscribe button. Kick the like button on this video and all of the other videos. And again, if you want to be notified whenever I upload new content. Go ahead and ring that notification bell. Ciao.